If we're going to do something that's going to really get to the community underpinnings of poor health that are structural, economic, educational, safety, and other things, and food availability in the neighborhood, as well as health and healthcare. If we're going to take a holistic approach to this, we need to make sure that we're partnered, the hospital leaders, with community leaders in sharing power. Uh, an old phrase, nothing about us without us, that we can come into a situation thinking we understand, and the community understands it in a totally different way. And so we set this collaborative up to actually try to do something about the death gap. And we said we're going to reduce that death gap, the life expectancy gap between the Loop and the West Side, that 16-year gap, by 50% by 2030. And many of the hospital CEOs said, "Well, how can you say that?" Of course, I said to say anything less would be shameful, to do anything less. And we decided there's probably four places we could really make a difference. One is, what if we hired locally? And then we got into making sure people got living wages. So we changed the entry wage to our organization. It wasn't enough to hire someone into poverty. And then we realized that our low wage employees didn't have a pathway into the higher paying professions in healthcare, which have a lot of job openings. So it was hire locally and create career pathways that lead to wealth. And to do it with incumbent employees, not just from the community. We also did from the community to jobs in healthcare, but actually incumbent workers. So you have a medical assistant who wants to be a nurse. Well, can we put you on a pathway that gets you to be a nurse someday? And then purchase locally. We realized we couldn't do it alone, so we created this entity called Westside United, which you can look up, www.westsideunited.org. And so we created this. It's actually kind of a department of Rush, but it exists as if it's a separate NGO. It's called Westside United, and it has that community voice equal with the hospital voice, with a 3-year strategic plan, which was a lot largely around economic, all those four, we call them the four puzzle pieces of work, of economic vitality, education, the neighborhood environment, and healthcare, and really driving ahead.